Thank you so much for being here with us today. And as you know, we've invited this about 60 of our leading innovators in the Boys and Girls Club space that have been here with us over the last couple of days. Talking about scale and scaling up, but more importantly, scaling with impact. And I know when I had the opportunity to chat with you as we were inviting you to join us, that we had some great conversation around the idea of impact. But let me just start with this question. Obviously, Stacy told us a lot about your career in philanthropy. Can you maybe just start off by sharing with us, what made you join the Blank Family Foundation? I guess almost 3 years ago. But what impressed you about this organization?
3.5 years ago, I joined, and as you heard from the too long introduction from Stacy, I have had a few stints in a few large foundations, fairly traditional foundations. I mean, big, oversized, you might say, but in some ways traditional. In that it was an endowed foundation, we gave money away in defined areas. The Blank Foundation was really different and unique in some very compelling ways to me. It was at a point where Arthur he was a giving pledger, had decided to give more of his wealth away sooner and to do it with his kids. So they had gone through a process where they identified new areas of giving as they were scaling the giving into some new areas. I love the areas they chose, the existential issues really of our day. Climate change, democracy, youth development, mental health and well-being, and the west side of Atlanta, the seat in many ways of the civil rights movement of not just the city, but the nation. So there was that. I love the areas they chose. And there was the opportunity to leverage the businesses, as Stacy referenced, which is just very unusual. Most endowed foundations don't have living donors who, for Arthur, it comes out of one pocket or another. It doesn't really matter. He wants to use all of his resources for social good. So where we can draw on and leverage the power of the businesses to get messages out about the importance of democracy or the importance of reducing stigma for mental health or whatever the issues are, the NFL has a platform unlike any other. And so the opportunity to come here and have that be a tool in the toolbox was just unprecedented. And then finally, who you work with matters. Mm. So meeting Arthur and the family and feeling very values aligned was what sealed the deal.
Fantastic. Thank you for sharing that. You talk the 5 things that you mentioned. A couple of them I think are really important to us as a movement, particularly wellness, and as we talk about emotional help for our young people, and also for the staff that work with them, and this whole idea of democracy, right? Because for me, I think about that through the lens of access and economic mobility, social mobility. So as you've joined the foundation 3.5 years ago, and those big topics. I mean, so do you see any change in terms of future direction, or as you guys are thinking about what's coming next?
Yeah. Well, we're still wrapping our arms around the existing areas. They're big areas. So we have developed a whole new strategy for the democracy area, and we're likely to develop a second. But the first one is really addressing the hyper polarization in our political sphere and trying to have electeds, people who move into elected office, be more responsive to their constituents and constitution than party. So we have a whole strategy related to that. We've developed a strategy in climate change related to green energy and deploying clean energy so that all households have access to the benefits of clean energy. We've developed refreshed our strategy on the West Side to focus on housing and financial inclusion as a vehicle for economic mobility for West Side residents. We're just about to bring forward a strategy for youth development to our board in a month. So I won't yet talk about that now, although I'm sure it's of interest to everybody in this room.
Well, I was going to unpack that one.
But we will focus on 14 to 24-year-olds in our regions of interest, which is primarily Montana and Georgia. And then mental health and well-being, we're in an exploratory phase where we have not yet settled on a strategy, but we expect to in 2025. So those are big areas to get our arms around. We're not likely to take on anything new quite yet, although, this is a family that's very dynamic and always looking to address important existential issues of our day.
So let me just pivot just a little bit. I mean, obviously we heard about your impressive career, and you've been at the forefront of strategic philanthropy and organizational effectiveness. Could you share a pivotal moment or an experience that has influenced your philosophy in philanthropy?
One is very early in my career, 1989. I was as a young person, very data oriented. I always loved story and data. I still like stories and data. But as a young person, I was very oriented towards math and statistics. And when I came out of graduate school, I really wanted to help bring high quality data to nonprofit decision making. That was sort of my ambition. And when I was 26 years old, I was working my first job out of graduate school. I was working for this applied research nonprofit consulting group, and we had just gotten the very first evaluation to do an evaluation of a community-based HIV/AIDS prevention program in San Francisco. So I was living in the Bay Area at the time, and it was the first time that the Centers for Disease Control had given grants to community organizations to do HIV prevention. Up until that point, none of the CDC's work had been to community-based organizations. And I had done some of my graduate work on the AIDS epidemic and the shift from at that time from largely the gay community to poor communities and drug taking communities where injections were happening. And so I was so excited. I was going to be the lead evaluator on this HIV prevention program, and it was being led by this man named Danny Keenan. And Danny was a man who was living with AIDS. So this is 1989, and there weren't ready treatments like there are more of today. And he had been training to become a priest. He had a fire in his belly until he came out as gay. And he was just this impressive guy. Really, just like I was sitting at the sort of launch meeting, where there was a lot of ceremony at this launch meeting where the head of the nonprofit organization was there. It was Huckleberry Youth Programs in the Bay Area, for those of you who know them, and the head of my research organization, and lots of people sitting around talking about this and that. And we talked about what the program was going to be working with these young kind of runaway kids to try to help spread prevention messages to them. And we had that ceremonial meeting, and then we left the meeting, and Danny and I went to another room to talk about what we might do together. And he said to me, "Fay, I don't give a shit about the evaluation. I'm here to save lives. You do what you have to do and just stay out of my way." And I was like, okay. I was like so green at the time. I was 26 years old. I was so deflated. And that was literally what he said. And we talked, I don't even remember, like the rest of the conversation was kind of a blur to me. And I won't tell you the whole story, but he really laid down the gauntlet in a way in that meeting with me as a young person wanting to add value, as a young evaluator. And we spent several years working together. He died about 5 years later. But during that time, we developed an evaluation that actually gave him data to help him improve his program, where he understood then where he was making progress, where he wasn't. And he actually used the data to improve make course corrections. He advocated for an increase in our budget for the evaluation so that he could get more data to make a case for why they needed to expand their program. And they used that data. He made the case, and they developed a whole integrated psychosocial clinic, the first of its kind, for kids who were runaway kids in a lot of trouble in the Bay Area. And um, he taught me something, which is that the evaluation's role needs to rise to the level of helping people save lives. That it can't just be a bureaucratic process. It can't just be data collection to put in a nice chart and have nice visuals, but it actually has a very high bar to get over. And just from sitting here for the last half hour, I heard how important data are to you and to what you're doing, and I think that's true, but it has to hit a high bar. It has to help those young people who you are here to help.
The lesson that you learned that day helped you in how you determine, who you will fund, or who the foundation that you are working with will fund.
That's a great question. We always like to ask about evidence. So has a program been evaluated? I was just, right before this coming up here, I was just talking to David, and we were talking about a program. I said, has it been evaluated? We always want to know, has the program been evaluated, and what have you learned? And it's always, evidence is really important to us. It's not a reason to fund or not fund. Mm-hmm. Lots of things don't have evidence. The best innovations, sometimes it takes a while to gain evidence. So for us, it's understanding what the evidence is, what it tells us, where it exists. And if it doesn't exist, but it still feels like a really compelling idea or a really compelling thing to do on a problem that we care about, that seems promising, we might fund it and say, let's make sure that you also evaluate it along the way so that we're learning, you're learning, and evidence is part of the picture.
Makes perfect sense. Thank you. So let's go to your third point. You talked about this whole idea and importance of voice. And I know you've been engaged in multiple initiatives to help formalize that process around bringing in community voice and youth voice in a meaningful way. I think you did that work at Youth Truth and Fund for Shared Insights, right? So what have you learned about the different approaches in leveraging community and youth voice, specifically youth voice, community and youth voice for the work that we do?
Yeah. So my first foray into constituent feedback was with students at the Gates Foundation. So I was there 2006 to 10. And some of you may remember that was a period when the Gates Foundation was very involved in small schools and helping fund small schools, reshape small schools, reshape large schools into small schools, all manner of things that they were doing related to schools. And the Gates Foundation is very data oriented. They were collecting lots of data about students and about schools and graduation rates, matriculation rates, all kinds of data, and but no student feedback data. So it was really when I had that feeling in the pit of my stomach, that was the first thing I did. I went to the leaders of the different programs and said, are you interested in experimenting with some feedback? There was a program in Africa working with smallholder farmers. They did a pilot, and then we did some work with a U.S. program on schools to pilot what we called the Student Voice Initiative that they became Youth Truth. And what I learned is how hard it was at the beginning. Now it's less hard. At the beginning, it was really hard to have student voice have its rightful place at the table, I would say, which was interesting because so much of the early days of the Gates Foundation, every funder has a kind of a different approach that it takes. The Gates Foundation was very, especially in those early days, product oriented. It came out of software, so a lot of the early investments there in like malaria nets, vaccines, was very product oriented kind of solutions that they pursued. which was fine. But in most product-oriented fashion, you get consumer feedback. So it's one thing if you're going to be pursuing products, but then you also want to get feedback. So one thing that I learned is that I was just surprised that consumer feedback, as it were, wasn't part of the data mix already, and that it was an uphill battle.
Mhm.
We were a little ahead of the moment, before George Floyd, before the equity explosion in terms of interest in equity and interest in voice, and now I think there is more interest there, which I think is overdue. I think when we went in and developed the Fund for Shared Insight, and we developed this other general tool called Listen for Good, which is a very simple, elegant tool for feedback from all kinds of people who get nonprofit services. So whether you're getting a senior service, after school program, food services, if you get direct services, vocational services, you can use Listen for Good as just a very simple feedback tool. And one of the things that we learned from Listen for Good, from looking at and partitioning the data across hundreds, now thousands of people who've participated in giving feedback, is that young people tend to use the lower end of the scale more than older people.
Yeah.
So that's important to know, because
absolutely.
that's the value of benchmark, so that when you're comparing your program to other programs, you're comparing like to like, and you're not comparing teenage feedback to 40-year-old feedback, where your teenagers are going to give you maybe lower ratings, but they're not as polite as the 40-year-olds.
I think these guys know.
So that's really important. Not all feedback is created equal. That's the value of having a validated tool like a Listen for Good tool or a Youth Truth tool, is the value of benchmarks, because comparison is the coin of the realm in any kind of measurement, as most of you will know here. And so being able to compare, your feedback to another Boys and Girls Club, or to another program that serves young people, is really important, because you could say, well, actually, we're getting 7.5 on average, but it's better than the 5s that everybody else is getting. So we're doing something right here. But if you don't have that point of comparison, then you just look at a 7.5 and you think, I don't know if that's good or bad.
Yeah, good point. Good point. And thank you for sharing that, because it takes me to my next question, because that evaluation that you're speaking about is super important to a lot of the folks that fund our organizations. So when you think about, obviously, evaluation, and we'll unpack that more in a moment, but what are the key elements that contribute to a successful relationship between a funder and a nonprofit, or say a Boys and Girls Club?
Well, we probably, you ask different people, they'll come up with different answers, but you're asking me. So I would say we have a philosophy that we've adopted at the Blank Foundation that we call the 3 R's, which stands for results, relationships, and respect. And we try to bring the 3 R's to bear in everything that we do. We have relationships with nonprofit partners because we, and presumably they, want to achieve results in the world, whether it's on green energy and climate change, or democracy, or young people getting employed. You want to achieve results. But we know that it's really essential that we have a strong relationship with our nonprofit partners, to be able to both provide support, understand if there are challenges, understand how we might be able to help address those challenges, not to have our nonprofit partners scared to come forward to share something with us. We know that we're working on challenging things. Stuff happens. And, we want to have a mutually respectful relationship and interchange. So results, relationships, and at the core of relationships is respect. But we call it out because we think it's just really important. We have a role to do as stewards of the resources the Blank family is entrusting to us. So we have to respect them. but we also have to respect the grantee partners, the nonprofit partners that we're working with, and understand the unique challenges that they're facing, and be able to manage those relationships as we're all pursuing results. So trying to balance all three of those is what I think, and what we try to embody is the keys to successful ways to work together.
So let's take that to the broader foundation world. I mean, obviously, you've worked with some of the largest, foundations in our nation. So as you think about those three R's, is there any other advice that you would give our audience here today as they're working with, from family foundations to, kind of the larger big box foundations, community foundations? Because I'm assuming there's a community, a foundation community where you all come together to have conversations. So,
Yeah.
any insight there that you can share that will help us as our local clubs as they go back to their communities and working with their local foundations
Yeah.
or national foundations?
Yeah. Yeah. I mean, there are, just like nonprofits aren't homogeneous, foundations aren't homogeneous. So there's many different stripes of foundations. I guess I would offer two pieces of advice. One is on the measurement, and the other is on the relationship. So on the measurement side, I would say get ahead of your funders. So, they're not all funders care as much about measurement, but a lot do, and a lot of the bigger ones do. And so if you want your $1 million check, I'm not sure who that was from over there, but I do think, getting ahead so that when funder says, well, what are your outcomes and how are you going to measure, or what data do you have, that you have the answer to that. It's honest, and so that you're not being led by the funder, because I don't think those are usually end well necessarily. So that's one piece of advice. And maybe that the funder has interest. There's a conversation that can then happen if the funder has interest in your outcomes, but also a few others. You can have that conversation, but I wouldn't start with just the funder's interests. I would start with yours and how you're going to measure your own sense of what you're trying to accomplish and success. In terms of the relationships, there was an interesting study done many years ago. I mean, I'm dating myself. It was like 20 years ago, that looked at the likelihood of getting funding if you meet a funder in person or not. So you can all guess, but it was actually documented that the likelihood of getting a grant is just much higher if you meet in person. So, where you can make that happen, develop that relationship. It's not the only key, but it is part of a key. Mm-hmm. Not everybody will tell you that, but I do think that that's just the reality, is that funders are people, and so they're looking for data, but also having relationships matters.
Thank you for those 2 points. Let's unpack the R part and what the R around results. And obviously, you've had a lot of experience in measurement and evaluation. What advice would you give to our clubs that are trying to that are trying out new ways to make a bigger impact, which is a part of why we're here today? It's, that they're trying out new ways to make a bigger impact, especially when they're working together with partners, and frankly may not have the control of all of the over all of the results. So given your experience in measurement and evaluation, what advice would you give to clubs trying out new ways to make a bigger impact, especially when they're working together with other partners who may not have full control over the results?
Yeah. Well, Lorraine, the phrase "full control of the results" is such an interesting one, isn't it?
Yes, it is.
Can anybody in the room raise their hand who has full control of the results? I do. We are so far from having full control. Like, we're 3 steps removed from the things that we're looking to see happen.
Yeah.
People think we have power and money, but we certainly don't have control. So it's an interesting frame because really none of us we have control over, like, if I get up and walk off the stage, I'm controlling my own body, right?
That's right.
But really, we don't have control. Like the trick of this is, and this is why, in the term of art, which some people love and some hate, is the theory of change, right? It's a theory. It's just a theory. Like, how do we think change is going to happen? We have these charts and arrows, and we think, if this happens and you combine it with that and you do it at this level of intensity and frequency, that other things are going to happen at this rate of change.
Mhm.
It's a theory.
That's right.
That we then try to gather data, but we have no control. We try to encourage and persuade and market and invite and cajole the kids to come, or the seniors to have better food for kids to eat, whatever it is. But really, none of us have control. So just something about that phrase. I think it's important to acknowledge. We really we don't have control. So how do you stack the deck? In favor of the outcomes that we're seeking, in favor of the results that we hope will be good for the young people coming to your clubs, things that they want for their lives, their parents want for their lives, you want for job satisfaction, your board is looking for, your funder, all those things. How do we stack the deck for that? And again, there's no silver bullet, but I do think it's sort of I would say take a surround sound approach. You have to start with a clear strategy. That was my lesson number 2. That is really important, because everything does, even though I'm poking a little fun at the theory of change, the truth is you need one. You need to have some theory about how you think change is going to happen, and to be clear about it, and know that it's it can be a working, dynamic thing that should evolve and be a living document and approach, but putting a stake in the ground to say, we think workforce is the way that we're going to go, and these are the pathways that we're going to pursue, and these are the milestones we're going to hope to hit, and so forth. And a few years ago, I wrote an article for the San Francisco Innovation Review about a 3-legged stool of measurement. So once you have a strategy, I think there's sort of 3 things that you need to do to measure that work. And I wrote it because I was so focused on feedback, on rapid feedback loops from the people that were seeking to help, that I didn't want people to think that I didn't think evaluation and monitoring were still important, because I do. I think they're really, really important. So I think we want to continue to have third-party evaluations to really help us put our work to the test of, are we really helping the people that we're setting out to help, and to use as much rigor as we can in answering those questions, to monitor the work in an ongoing way that an organization can do on its own, to say, who are we reaching? Are we reaching the young people that we hoped to, in the numbers that we hope to? Are they coming in? Are they not coming in? Are we seeing even short-term outcomes? That kind of monitoring that gives you a real sense, has your finger on the pulse of what's happening and who you're serving, is really critical. And then feedback is the third leg of that stool, which I think has been underinvested in, but I do think is a way of getting rapid ideas about how things are working for your consumers, for the young people that you're serving. It's not the be all end all, but it is a very important engine, both of knowing how are people experiencing your program, and also ideas for innovation. Because even when you have evidence, it doesn't mean you stop innovating. So that's the other thing. I mean, that's why you need a dynamic strategy. So I would say, using all 3 legs of that stool, and I'm happy to give examples of how that I think has worked really well in practice for some organizations where have been real models of that. I think is really important and can.
Yeah, would love to hear just one quick example of how somebody has used those 3 legs.
Yeah. So I'll give you an example of nurse-family partnership. And it's one I wrote about in this article too. But nurse-family partnership, I'm sure many of you do know, but they were started as a research project up in Elmira, New York, many years ago. And the idea was that they were going to test out the idea of matching, a nurse with a first-time mom to help them have good birth outcomes and early childhood outcomes, early parenting outcomes, and to see how that went. And it was a pilot. It was a research study. That research study showed very good effects. Where in that pilot there were really good birth outcomes when you had the nurse visiting with the mom regularly before pregnancy and then up to 2 years after pregnancy. Really good birth outcomes, really good breastfeeding outcomes, excellent early parenting outcomes, like all the things that you would hope for, they achieved. And they had a control group and they repeated it many times. They began to scale the program nationally. It even got a line in the federal budget. Like became a very successful program with a randomized controlled trial. They did they were based on this very robust evaluation evidence. They had a very big monitoring system where they monitored the frequency of nurse visits, and the nurses, tracked everything that they were doing, and they were scaling around the country. And when we were launching our Listen for Good work, there was a new CEO of Nurse Family Partnership, and she said, I really want to do this Listen for Good work and hear from the moms about how are they experiencing our services and programs. And we said, great. So they became actually part of the Listen for Good pilot. And they started to plan with the nurses to do this. And the nurses were, as you might imagine, nervous because, they were worried, or what are the moms going to say? And so they were planning, and then they realized they didn't even have all the phone numbers for the moms, and on and on and on. Finally, the CEO said, "Okay, we're going to do this. we're just going to do it, and we'll see how it goes." So they sent out via text the Listen for Good, which is a 5-question survey. Very simple. Happy to talk about what that is, but a 5-question survey to the moms via text message to 10,000 of them, and within 20 minutes, they got back almost 1,000 responses.
Wow. Wow.
That's pretty good, right?
Yeah.
And among the things that the mom said, the first things that they said was, "Thank you for asking." Because I don't know about you, like when you fly on a plane or go to a hotel, like we get surveys all the time. How was it? Rate us, this and that. These moms don't. They don't. And so to be asked their opinion about how is it, how's it going with the nurse was important. It was powerful. It was asking. It was giving them agency to say, how is it going? And that was the first thing they said. So that's a win right there.
Absolutely.
Right? Just asking and making people feel like what you have to say matters. And then the second thing they said, much to the nurses' relief, was they like their nurses. So that it's always risky business. This isn't just a job to these nurses. It's their work. It's their heart work. And they gave really good positive feedback about the nurses. The important thing about asking for feedback is you want to ask what's good about this program and what could be improved. And they had ideas for improvement. And that was important too. And a couple of ones that I'll just mention now. One of them, and I don't know, I had 2 kids. I don't know how many people have born children in this room, but they said, we would appreciate it if the visuals that you use didn't show moms as though like they're all put together, they got their hair done nice, and like we're sitting on the toilet and trying to breastfeed, and we can hardly keep it together. So actually seeing these beautiful women makes us feel bad. Sorry. So that was one thing they said. They're like very practical thing that they said. The second thing they said was, we know that there are all these other moms that you're working with, and we'd like to maybe meet them.
Mhm.
So that sort of launched this idea of doing some, network with other moms. And then the third thing they said, and this was, back in 2015, 16. So you remember where we were 8 years ago before all the apps. They said, we love the material that you give. They had these big binders of material that they would give to the moms about parenting and, how, your kid at 1 month or in utero at this time or that time and how to handle different. And they loved them. They said, these are great binders full of great material. But sometimes, we move, we do this, we that, we lose them. And can you put it in an app? And the and their family partnership was like an app. Like they never thought of it. They never thought of it. So, and now of course they have an app. All the materials in the app. All these women have phones.
Yeah.
They just bring their big binder with them. But at that time, 8 years ago, the middle class women who were leading the nurse family partnership, they just never thought of it. It was 8 years ago. Now there's an app for everything. That wasn't the case then. And so it's just a great example of how asking for feedback can give you ideas for innovation that can accelerate what you're trying to accomplish.
Absolutely.
Right.
Yeah. Thank you for sharing that story and bringing that to life for us. So, y'all help me in thanking Fay. Thank you so much. Have a little token here for you. Thank you so much.